Hello, welcome back to part 3 of our neuropathy series. So, what I'm probably guessing is you went to your doctor, you described the burning, the tingling, the numbness, and maybe that your feet don't even feel connected to you anymore. They just feel like a separate part of your body. And your doctor, who genuinely cares about you, wrote you a prescription for gabapentin, maybe Lyrica, Cymbalta, and told you this will help to manage it. And maybe it did help for a little bit at first, or maybe it didn't help at all, or maybe you're on the maximum dose now and you're still in pain and wondering why nothing is getting better and why you're not getting better, or why you have so many side effects. So here's what no one told you. Those medications were never designed to heal your neuropathy. They were designed to change the way that your brain processes the pain signals. That's a very, very different thing. And understanding the difference might be the most important thing you learn in this entire series. Hi, I'm Rebecca Gibbons, acupuncturist and registered nurse. In episode 3 of this neuropathy series, I'm going to walk you through exactly what the most commonly prescribed neuropathy medications actually do and what they don't do, and what a treatment approach that actually targets nerve repair looks like. I want to be clear and upfront. I have great respect for physicians prescribing these medications. They are working within a system that has real limitations for peripheral neuropathy care. And that's not a criticism, it's an honest assessment. And it's the reason this conversation is going to happen. A lot of my patients come in and they don't like the side effects, they don't feel like it's helping. So let's start with the fundamental distinction, because once you understand this, everything else will make sense. There are two completely different things a treatment can do for peripheral neuropathy. It can change how your brain and nervous system perceives pain, or it can support the actual repair of damaged nerve tissue. These are not the same thing, not even close. So imagine you have a slow leak in a pipe in your home. Water is dripping down through the ceiling. One option is to put a bucket underneath the drip. The water is contained, you don't see the damage spreading, life continues. The other option is to find the pipe and fix the leak. Pain medications in neuropathy are the bucket. They catch the symptom, the pain, the burning, the disrupted signal, so you notice it less. But the pipe is still leaking, the nerve damage is still there. In many cases, it is still progressing. You just don't feel it. That signal in your brain is turned off. This is not a fringe opinion. The leading neurological associations acknowledge that current pharmacological treatments for peripheral neuropathy are aimed at symptom relief, not disease modification. I'm not saying anything controversial. I am just saying it plainly because most patients have never heard it stated this directly. So let's go through the most common prescribed medications one by one. Gabapentin, or another name for it is neurontin, most commonly prescribed for neuropathic pain, to calcium channels in the brain and nervous system, which reduces the release of neurotransmitters involved in pain signaling. In simple terms, it turns down the volume on the pain signal. For some patient, it provides meaningful relief. I don't want to take that away, particularly in the early stages. For many others, the relief is partial or temporary, and the dose has to keep increasing to maintain even partial effect. Common side effects include drowsiness, cognitive fog, or brain fog, which patients feel like they're moving through mud. Dizziness is a common and increases fall risk, which is particularly concerning for neuropathy patients who have already have balance issues. Some patients report weight gain, swelling in the extremities, and dependency upon gabapentin can be difficult to discontinue and should never be stopped abruptly. So gabapentin does not repair nerve tissue, improve circulation to peripheral nerves, or slow the progression of neuropathy. Multiple large studies have found it only modestly more effective than placebo for many patients, and yet it is the near universal first-line prescription. Let's talk about Lyrica. Similar mechanism to gabapentin, which is with a higher price tag. Pregabalin, brand name Lyrica, works through a very similar mechanism to gabapentin. It's in the same drug class. The primary differences are that it's absorbed more predictably by the body, which means the dosing is a bit more consistent. And it has FDA approval specifically for diabetic peripheral neuropathy and fibromyalgia. The side effect profile is also very similar: sedation, brain fog, dizziness, weight gain, and there is a dependency risk. It's also significantly more expensive than gabapentin. Again, not a nerve repair medication, a pain modulation medication. There is a meaningful distinction. So another drug is often prescribed as Cymbalta, an antidepressant repurposed for nerve pain. So Cymbalta is an SNRI, which stands for serotonin norepinephrine reuptake inhibitor. It was developed as an antidepressant and is also used in anxiety. It received FDA approval for diabetic peripheral neuropathy because it affects norepinephrine pathways that are involved in pain perception in the spinal cord. So for patients who have had both depression and neuropathy, which is very common because chronic pain and mood are deeply linked. So Cymbalta, another name is duloxetine. I apologize, I've been using the brand name. It can address both the depression and pain, and that's why it's genuinely useful. But its pain relieving effect, again, is at the level of signal processing, not nerve repair. Side effects also include nausea, dry mouth, sleep disturbance, sweating, and some sexual side effects. So discontinuing it can be extremely difficult because patients often describe some withdrawal symptoms, including what's called brain zaps. It should always be tapered slowly and under physician supervision. An older antidepressant used off-label for nerve pain is tricyclic antidepressants. Something called Amitriptyline is the most common. It has been used for neuropathic pain for decades. Like duloxetine, they were originally developed for depression and found to have pain-modifying properties through their effects on serotonin and norepinephrine. They work. For some patients, they work quite well for sleep and pain management, but the side effect burden can be significant sedation, dry mouth, constipation, blurred vision, heart rhythm effects at higher doses, and some cognitive effects that can be pronounced in older adults. And again, the mechanism is central nervous system modulation. The peripheral nerve damage itself is not being addressed. So a last resort, and one that often makes things worse, are opioids. Opioids are sometimes prescribed for severe neuropathic pain when other medications haven't worked. And I want to address this carefully because it's important. Opioids are actually not very effective in neuropathic pain. This is well established in the pain medicine literature. Neuropathic pain responds to opioids much less than other pain types, and the risk for dependency, tolerance, and cognitive effects, hormonal disruption, and very real possibility of opioid use disorder. So there is also emerging evidence that chronic opioid use can actually worsen pain sensitivity over time, a phenomenon called opioid-induced hyper. So if you are currently on any of these medications, please do not stop them without speaking to your prescribing physician first. Several of them require careful tapering to discontinue safely. If our goal is to give you just information, not guide you away from your medical team, ideally, integrative care and conventional care work together. So if these medications aren't repairing nerves, what does? What does peripheral nerve tissue actually need to heal? 3 things, primarily: blood flow, neural stimulation, and time. Peripheral nerves are surrounded by tiny blood vessels called the vasa, the blood supply of these nerves. When that blood supply is compromised by diabetes, by inflammation, by toxic damage, the nerves are essentially being starved of the oxygen and nutrients they need to function and repair. Restoring and improving that microcirculation is foundational to nerve recovery. No medication on the standard neuropathy list addresses not one. The second piece is neural stimulation, providing the kind of precise therapeutic signal to the nerve tissue that prompts the body's own repair mechanisms to activate. This is part of why acupuncture is so effective for neuropathy. The needle placement creates a very specific physiological response. Local release of neuropeptides increase blood flow, activation of nerve fibers. That is quite different from anything a pill can do. And the third piece is time. Nerve tissue heals slowly. This is simply biology. The nerves that travel from your spine to your feet are some of the longest in your body, and they regenerate at roughly 1 millimeter per day under ideal conditions. That is why our treatment program usually runs 12 to 16 weeks with consistent, frequent sessions, because that's what the biology actually requires. We're setting a foundation for the body to be able to heal. Kind of like when you're gardening, you need the right soil, you need the right fertilization. Plant the seed and it starts to grow and repair. So, at Acupuncture and Wellness of Pensacola, our neuropathy program is built around these three pillars: circulation, stimulation, and consistency. We combine acupuncture, which has decades of evidence behind it, behind a 3,000-year medicine, and we also use non-invasive microcurrent to help regenerate some of those nerves and increase that microcirculation. We always look at the whole patient. We look at nutritional status, blood sugar management, inflammatory load, because all of those things affect how well the nerve tissue can respond to treatment. Is it a quick fix? No. I'm always upfront with my patients. I won't tell you that. What I will tell you is that the patients who commit to coming in, showing up, who show up consistently over that 2, 3, 4 months, see real measurable improvement. Not just the pain is a little less, but it's actually a restored sensation, improved balance, better sleep, and getting lives back. This is a completely different outcome than just learning to live with it or learning to manage the symptoms. So I want you to ask yourself, has anything about your neuropathy actually improved on your current medication, or has it stayed the same or gotten worse? If the honest answer is no, that's important information, and it might be time to explore other options. So if you are in the Pensacola or Lower Alabama area, you can call us at 850-530-1028 or even visit our website at awpensacola.com. I want to leave you with this. The fact that your current medications aren't healing your neuropathy is not a reflection of how serious your case is or how unlikely you are to recover. It's a reflection of what those medications were designed to do and what they were not. There is an approach that targets nerve directly, and it exists and it works. In episode 4 of this series, we're going to go inside the actual treatment protocol, how acupuncture works for neuropathy on a physiological level, and what you can expect over the treatment span. It's one of the most requested topics I get, and I think you'll find it genuinely eye-opening. So subscribe so you don't miss it. I'm Dr. Rebecca Gibbons. Thank you for being here, and I'll see you in episode 4.